I got Ghost when she was 8 weeks old. Right away, Ghost was a crazy cat. She was climbing everything all the time. She was so energetic and so vocal. The second she saw me, she would scream a very happy meow. I noticed something was wrong because I would walk into a room and she wouldn't meow for me. She became more secluded. She became more quiet, more fatigued. She stopped eating a lot. She just wasn't her playful, like super excited self. I very anxiously, during a snowstorm, brought her into DoveLewis.
Ghost immediately looked sick. Based on my initial physical examination, I made some recommendations to Ghost's owners. So we ended up taking x-rays of the abdomen. What I could see on there was some mineralization in the region of the ureters. We also decided to do systemic blood work on Ghost at that point in time.
Her creatinine for her kidneys was a little bit too high. She had gotten healthy blood work her whole life, and so when she got that result of like high creatinine, it was clear something was wrong.
At that point in time, we made the decision to hospitalize Ghost on IV fluid therapy, and also so that Ghost could have an abdominal ultrasound the next day, because that would allow us to investigate where is this mineralization, what do the kidneys look like, and what type of disease processes should we be most concerned about and should we be focusing on.
Ghost had kidney stones. And those kidney stones were getting stuck in both of her ureters. So the body can't excrete the things that it needs to get rid of. But a lot of times, if a stone is in one ureter and isn't passing through, it's uncomfortable and it can make you sick, but at least the other kidney is picking up the slack.
We already had it on our radar to consider an internal medicine consultation because this is a very unusual case.
So at that moment, my goal was to talk to Ghost's owners and determine what our next steps were. And my recommendation at that time was to place a subcutaneous ureteral bypass, which is just a fancy way to say we're putting an implant in that creates a new route for the urine to flow from the kidney to the bladder.
I got a phone call from Dr. Davis. It became a situation where she needs surgery. I felt Dr. Davis had a very strong viewpoint on how to keep Ghost as healthy as possible, and I respected her opinion completely because we had gotten other opinions where we could just do a stint, and Dr. Davis laid it out to me very clearly. This has the best success rate. It is her best chance at living the longest, happiest life.
To have that surgery done in a short amount of time in most patients is crucial. It's such a relief to work here and be able to look at the surgeon that's also at rounds with me and then collaborate and talk about when can we do this, what's the next best step, how quickly can we get this done for this patient.
Ghost was still anemic, a little lower than she had been, and normally I would not have elected to transfuse her at that number because she wasn't necessarily clinical for it, but because we were headed off to surgery, I felt that was important to help her cardiovascular system.
Ghost has type AB blood, which is found in less than 1% of cats. Thankfully, because we have an in-house blood bank here at DoveLewis, we were able to get the blood that she needed. Most AB cats can receive type A blood if they're properly cross-matched, and we can make sure that they won't have a reaction to that blood. In Ghost's case, we did bring in one donor about at 9 or 10 p.m. to donate blood that night for Ghost to receive a transfusion overnight. We're very fortunate to be able to have this program in the community, to be able to have these blood products in stock, but then also have a network of people who are willing to bring their pets in for an emergency donation for patients like Ghost.
She got this surgery, and immediately out of surgery, she felt better than she has in a long time.
I was visiting her in the ICU in the days after, and she looked great. She was active and affectionate and everything that her owners told me that she was at home.
It's been months and months, and she still is doing really good. She likes going to the doctor now. I feel like she knows that they're helping her, and so she feels like she's just going to visit her friends. I think it's really important to have one building where you can have so many different specialists because there's a feeling of confidence in everyone's recommendations.
We have the luxury here at DoveLewis to be able to go from the emergency department directly into an intensive care unit, to know that we can get an abdominal ultrasound the next day, and to know we can also get an in-house consultation with our specialty services to make sure that our patients get the best care that they can possibly receive all under one roof.
The level of trust there when you have a place that's close by, and you know that they're hiring the best minds of our community. I just feel very lucky that I ended up at DoveLewis, where I know that her long-term care is covered by great doctors who really care for her and are really rooting for her.
When you donate to DoveLewis, you are supporting a hospital that can provide specialized care from top to bottom for our patients. And that's something very unique to have all these minds, specialized minds especially, in one facility that can provide that care, particularly in the Pacific Northwest. So we really appreciate your donations.